Your Shoulder Pain Cure. Medical disclaimer. This book is not intended as a substitute for the medical advice of a physician. The reader should regularly consult a physician in matters relating to his specific symptoms and specific condition, in particular with respect to any symptoms that they may require diagnosis or medical attention right now. The information in this book is for illustrative purposes only, and you should seek the advice of a physician first before attempting any information that you obtain, regardless of origin. Special bonus. At the end of this book, I will provide you a link with access to a step-by-step video on how to perform the shoulder pain exercises. Who this book can help. If you are suffering with shoulder pain currently and you are not sure if your shoulder can be cured, I can certainly understand your concern. Shoulder pain can be caused by a variety of reasons, and it is important to obtain an accurate diagnosis before attempting any form of exercise or treatment program. If you have recently developed shoulder pain and you have pain with any reaching activity or rotating motion in your shoulder, or if you've had long-lasting shoulder pain that keeps nagging at you and not improving, if you are unable to perform any overhead lifting or reaching activity and you seem to feel a stabbing pain or just limited range of motion in your shoulder, this book can help you. If you've been diagnosed from a physician with conditions such as rotator cuff tendonitis, subacromial impingement, adhesive capsulitis, bursitis, any of these conditions can be helped, and I feel this book can benefit you in providing you information that you can use to treat yourself. Who this book cannot help. If you have been diagnosed with a significant rotator cuff tear, it is very hard and difficult to improve your shoulder without seeking surgery. The reason that I say this is that because the rotator cuff is the main muscle group that controls the stability of your shoulder joint, when you have a tear, it long term will only get worse, and the pain and the swelling and the inflammation due to constant irritation will continue to increase in intensity, and it is not advisable to postpone surgery if it is indicated. If you have significant weakness in your shoulder compared to the other side, and I mean significant, it could indicate that you have a rotator cuff tear, and it is important to go to a doctor first to make sure that you get an accurate diagnosis through a manual exam or an MRI to confirm if this is the case. If you've been diagnosed with a labral tear or a severe osteoarthritis in your shoulder, probably any form of exercise will only aggravate your present condition, and surgery most likely, or any form of treatment of symptoms, would be advisable. If you've had trauma to your shoulder and you've sustained significant ligament damage to any of the specific joints in your shoulder, most likely you will be dealing with a form of instability in your shoulder joint, and many type of movements and activity will likely increase your symptoms and pain. It is important for that to be addressed first before starting on an exercise program. I realize that what I've just shared with you could be viewed as positive or negative, and this is not the intent. The intent of this book is to help you and provide you a form of self-treatment that you can use to improve your condition and reduce your shoulder pain. So let's look first at your symptoms.